It was 1854 when the Blue Death reappeared to afflict London for the second time, wreaking havoc particularly in the area of Soho. People called it cholera, and no one could fathom where it was coming from, much less figure out how to stop it. The disease was spreading rapidly and infecting a lot of people in a very short time. It had spread to Europe from its original reservoir in the Ganges Delta in India and struck terror in the hearts of the people as it took the lives of thousands of Europeans in this 19th century epidemic. The sufferers experienced violent vomiting and diarrhea to such an extent that they would become dehydrated, after which stools would start coming out as a greyish liquid resembling rice water. Those affected would get blue lips and exhibit a shrunken face due to loss of fluids and electrolytes, which could cause death in a matter of hours from the onset of symptoms if left untreated. According to the prevailing theory at that time, the miasma theory, cholera spread via the bad vapors in the air, and thus not much could be done to stop its transmission. Most physicians believed in miasma theory, except Jon Snow. No, he's not the curly-haired young man from Game of Thrones, but a curious London anaesthetist. Snow went out to the neighborhoods to inquire about people who had contracted the disease. After identifying the affected individuals, Snow charted their locations on a map of the city. He narrowed down the investigations by asking questions to every house and shop located near the affected individuals. What did they do for work? Where were the homes of those who died located? He then found that within 250 yards of the spot where Cambridge Street joins Broad Street, there were upwards of 500 fatal attacks of cholera in 10 days. Snow thought that the cases were not random occurrences, but in specific distributions, which means that it also had a specific cause. Even though at the time cholera were thought to be spread by bad vapors in the air, Snow had his own suspicion. He then retraced his steps to the affected residents, inquiring once again about their sources of water supplies. New information pinpointed the source of the problem to one specific water pump among the many located in Broad Street. However, the puzzling thing about the case was that some of the severely contracted victims lived far from that pump location, while the brewery workers near the pump were not contracted at all. Slowly, a plausible explanation started to emerge as the investigation progressed. He found that a deceased patient from a further district used to stop at the Broad Street pump to drink, whereas the local brewery employees rarely drank from that pump, since the company has its own well as the water source. This convinced Snow that cholera was spreading through the water from the Broad Street pump, making him request the pump to be shut down to the municipality. Right after the city officials removed the pump handle, the number of new cases dropped sharply, which proved that Jon Snow's hypothesis was right. Further investigations and research found that the outbreak had started when a mother of an infected child, who had contracted cholera from another source, had thrown the baby's infected diapers into a leaking dump only a meter from the Broad Street pump. The cause of this disease was later discovered by Filippo Pacini and Dr. Robert Koch, father of microbiology, in separate research to be the bacteria Vibrio cholerae that can be found in contaminated water, thus invalidating the miasma theory. Even though Snow was primarily an anaesthetist, his curiosity, initiative, and persistence to figure out the disease that spread in the community are in the spirit of epidemiology, a study about epidemics. Epidemiology itself will later become a part of community medicine, which is the field concerned with the widespread diseases that affect a defined population in a certain geographical area, including the history of a disease, the determinants, the effect, treatment, and prevention for the disease occurrence. Its goal is not only to diagnose the population's health problem, but also to plan and implement appropriate remedial measures, then evaluate its effectiveness. Thus, community medicine is an umbrella term encompassing preventative medicine. The medicine branch that focuses on disease prevention, and social medicine refers to the branch of medicine that takes social factors into account. Community problems like air pollution, traffic problems, and also water contamination, as happened in London 2 centuries ago, are the risk factors affecting public health that community medicine practitioners should consider. They also work on promoting health policies and healthy lifestyles within the community, an additional duty that distinguishes them from other practitioners. Since community medicine focuses on population, the practitioners need to perform community diagnosis, which includes getting demography and vital statistics, morbidity and mortality data, and surveys about health services available in the area. Community medicine is not a field limited to certain people. Physicians from any specialty can contribute and give positive impacts to the communities. By preventing people from getting the disease in the first place, they not only save thousands of lives, but also save millions in finances that would otherwise be lost to treat the disease. Thank you for your continuous support, especially our valued patrons and members who have been encouraging us to keep producing more quality content.